afternoon, everyone. I'm Dr. Rashmi Chaudhary, the Senior Obstetrician and Gynaecologist in Cloudnine Hospital, Bellandur, Bangalore. I have a working experience of more than 26 years in the field of obstetrics and gynecology. My area of specialization is the management of high-risk pregnancy and the complicated gynec surgeries. Preconceptional care and counseling is basically the advices and treatment given to the couples before they start planning for pregnancy. This period normally starts 2 to 3 months prior to the pregnancy planning. The idea behind preconceptional counseling is that the couples, both the husband and wife, should be in the best of their health, physically, mentally, in the best of their health to have a healthy pregnancy. It should be started 2 to 3 months ideally prior to pregnancy. The aim is that the couples, they should have a healthy baby and there should be a good pregnancy maternal outcome. So what we do in a preconceptional counseling, once the couples they come, we take their detailed history regarding their medical status, any disease they are having, or they are physically fit, or any surgical intervention in the past, their immunization status, whether the mother is immunized for rubella vaccine or not. We take the detailed history as well as about their nutritional status or like exposure to the normal consumptions of alcohol or the caffeine or smoking. All these history we take into account. After that, advice is given and we go for certain blood tests like the complete blood count, A blood grouping and RH typing, their rubella vaccine status, their serological status, and we do also the ultrasounds as well as we check the male partners also for in any infectious disease or anything like semen analysis, whether all the semen parameters are normal or not. After the proper evaluation, general examination, we give them particular advice. Once the woman is planning for pregnancy, their medical health status should be fine, like they should be not having thyroid disorders, their glycemic status for the last 3 months should be normal, and if they are found to be diabetic or a type 2 diabetes or a pre-diabetic status, their HbA1c level should be below 6%. And if it is not, then we maintain it with the medication and then they plan for pregnancy. If a woman is found to be having thyroid disorders, then we give them thyroid medication so that to bring the TSH level to normal in the range of 2.5, not more than that. And if they are found to be hyperthyroid, we treat them with propylthiouracil. There are certain women who are suffering from epilepsy and they start planning for pregnancy. They must come for preconceptional counseling because it is very important that because all the anti-epileptic drugs are antifolate. So they interfere with the folate metabolism and it can cause some neural deep defect, cardiac defects, facial abnormalities to the baby. So we advise them, ideally they should plan pregnancy once they are 6 months, there is no seizure, 6 months to 1 year. There should not be any epileptic episodes and they should be preferably on a monotherapy and drugs which causes minimal disturbance to the baby's health status and reduces the incidence of cardiac or any congenital malformation. After evaluation of these things, we give them advice of certain lifestyle changes, like they should be having a healthy lifestyle, their nutritional status should be good, and if they have any addictions of alcohol, smoking, they should refrain themselves. It should be stopped at least 1 or 2 months prior to pregnancy, because the smoking and alcohol can cause certain congenital malformation. It can cause miscarriages, it can cause some defects in the baby. To the mother also it is very harmful, can cause placental abruption, can cause premature intrauterine growth restrictions, small babies, and above and all, at the end we supplement them with a folic acid. 500 microgram of folic acid is advised to take daily, and they take it preferably after dinner. This reduces the incidence of neural tube defect in the baby.